All right, well, welcome everybody to the Beacon Point virtual discussion. The topic of today's discussion is bridging the gap to Medicare and Medicare basics, tips, strategies, and guidance from an industry expert. I'm Kobe Kress. I'm a certified financial planner and wealth advisor here at Beacon Point in Scottsdale. And as many of you have heard me say on previous events, it's our desire here at Beacon Point as a premier advisory firm, not only in Arizona, but across the country, to consistently connect you with world-class resources that can help you solve the very real financial issues that you face every day. And it's in that spirit that I'm very excited to have with us today Matt Gardner, president of the Gardner Insurance Group, which is a health markets insurance agency. But before I introduce Matt, I have a few housekeeping items as usual to make sure that you get the most out of today's event. So first, up here in your top right corner of your screen, you should see a few little icons. We're actually going to change things today. For those of you who have been on previous events, we are going to use a few slides today. So instead of speaker view, which is listed right here, I actually recommend that you use gallery view, which should give you the best viewing experience. It'll allow you to see myself. It'll allow you to see Matt, as well as the slides throughout the presentation. And then, as always, down here at the bottom of the screen, you're going to see a questions and answers button. Please, if you have questions, we have set aside a good chunk of time at the end of the event for questions. Don't miss an opportunity to have those questions answered by Matt. And I want to encourage you as well. For those of you who have a question in mind, you're not sure if you want to put it out there, somebody else on this presentation, on this discussion, most likely has a similar question, and they may not put it in there, and they would benefit from you putting your question in the Q&A. So please put your questions in there. I'll remind you a few times throughout, and some of you actually submitted your questions early, and I appreciate you doing that as well. So Matt Garner is president of the Gardner Insurance Group, which is a health markets insurance agency. And since 2007, he's worked diligently to build an agency of over 50 insurance professionals, all dedicated to taking the frustration out of the insurance process. One of the things I admire the most about Matt is that education is essential to how he operates, and he's committed to making sure his clients understand the plan and the strategies that they choose. I will share with you that Matt is a true expert in his field. He has structured his business so that his clients come first. And as an extension of that, he utilizes top-of-the-line resources and tools to ensure that his clients receive the best information, the best service, and the best solutions possible, all in a timely fashion. So with that, Matt, thanks for joining us today.
Kobe, yeah, thank you so much. I truly enjoy these opportunities where we can share some of the knowledge that we've learned over the years and really help the consumer decide on their own what may be the best solution for them. So third generation native here of Arizona, grew up here, born and bred, graduated ASU International Business. After graduating, I got into commercial real estate, bought and sold office buildings. I learned more about life, people, and business. 5 years in real estate, most people learn in a lifetime. And as a dream as a kid, I wanted to be a baseball player, a firefighter, and here I am. My dreams came true. I'm in the insurance business. It's actually been a blessing, but as you can see, my background, baseball is a passion. You and I have been able to share some of that. And as we mentioned earlier, I'm married. I have 2 kids. My daughter's 10. My little guy is 9. So between managing my office of over 50 agents, keeping those little boogers on the straight and narrow is kind of where I spend my time.
Well, that's great. Thanks for joining us today, Matt. I'm going to ask you real quickly here for the folks out there. I'm going to share my screen. We do have some slides that we're going to go through today to add some visuals. Can you see that, Matt?
Yeah, looks good.
Great. Okay. Well, let's jump right into the conversation. I know we have a lot to cover, and as I said, I want to leave a good amount of time at the end of the presentation for questions. So as you know, the topic of today's discussion is bridging the gap to Medicare and Medicare basics. So with that in mind, Matt, can you outline for us the basic problem that we're trying to address today? What do we mean when we say bridging the gap?
Yeah, so it's definitely, there's a lot of things that go into this. And the challenge is a lot of our friends that are between 55 and say 64 years old, they're looking at the state of the economy right now, and maybe some people are offered severance packages, or they've been furloughed, or frankly, they're just ready to shut it down and enjoy their retirement. But it's, what do I do with my medical benefit? How do I protect my health? How do I protect my financial wealth by not overpaying for products to get me to what I like to call that Disneyland area of 65 and Medicare. So, you know, managing those expenses is a big concern, you know, and it doesn't have to be. I think if you have the right information, some people may choose because the benefits might be a little bit more attractive if they stay on with employer, if the employer's paying the lion's share of the premium. And other people might say, hey, look, I'm ready to spend time with my kids or grandkids. So we're going to try to unpack that today the best we can.
Yeah, that's great. Thanks for covering that for us. So now that we understand that basic problem, why don't you give us a high-level overview of some of the solutions that are available for folks out there who are taking that severance package, maybe have been furloughed or have just decided to retire early? What are their options? Give us a high-level overview.
Yeah, and sometimes it's voluntary, as you said, and we choose to, you know, move from corporate America. And then, frankly, I mean, when you look at 10 million people unemployed, 3 to 20 as we come through the next wave, there's really 6 areas to think about. Obviously, COBRA being one of those. You know, if you read the paper, you've heard about the marketplace or Obamacare, healthcare.gov, the marketplace, the exchange. It's essentially the same thing. It just kind of gets talked about in different mediums. Medicaid, not everybody's eligible for Medicaid, but some people are. I think that's something that should be considered. Obviously, getting us to Medicare is a very big concern for a lot of our population that's aging into Medicare. I believe the last statistic I read 11,000 people are turning 65 every day. So it's a big thing to be cognizant of. Short-term medical has been pretty interesting over the last couple of years. And short-term medical is typically designed to get somebody from one job to the next. But in the case of where we are now, there's some longer there. And then frankly, 64 that are maybe tired of working for somebody else and they want to start their own business, or maybe their spouse owns their own business. You know, looking at group benefits through a smaller entity, 2, 3, 4, 5, 10 people, is something to consider as well.
I'm gonna stop real quick and just let everybody know, as everybody knows now, we're working remotely, some of us, and having to deal with these virtual events and not doing things in person. So if we have at any point, there's any kind of connective issues, if you miss something that you were interested in, please send us a note, put it in the question and answer. We'll make sure that you get an answer there. We could experience slight breakups from during the presentation as everybody's kind of coming in from everywhere. So thank you for your patience. If we do have an issue, send us a note and we'll get it covered. Matt, you mentioned COBRA. So I always think that COBRA has something of kind of an image problem. People know that it is expensive and they know that it should be used maybe as a last resort. Besides those two things, can you walk us through COBRA, how it operates, and when it might be the right option for folks out there, the right solution, maybe some pros and cons?
Absolutely. If you're able to advance the slide here, perfect. So COBRA was designed for people that have either been reduced in hours and are losing medical benefits, they're quitting employment, or frankly, their boss thought it was a good idea for them to go spend more time with their family, as we like to say. But typically, COBRA is an extension of your existing. A lot of our friends that are 55 to 64, this is a viable option that I think should be considered. The COBRA situation typically is 18 months. In some cases, you can keep it for longer. On the next slide here, if you're able to advance that for me, you're going to see some advantages and disadvantages. So the biggest advantage COBRA has is it's the exact same coverage that you've had. So if you got let go or terminated and you've already met some of your deductible, yeah, it might make sense to pay that higher premium because we're already in 100% coverage and that kind of thing. The network of doctors and hospitals is going to be identical to what you've been accustomed to. So if there's certain doctors or hospitals that are must-haves, might be considered. Some of the individual products out there might have limited networks, so that might be advantage. And then again, for our friends that are 55 to 64, how group insurance works is when you're with a large company with hundreds of employees, they typically take the average age, average health, and that's how they get the premium. So if you have a 25-year-old and their net premium is $300 a month, and you have a 64-year-old and their premium is $1,200 or $1,300 a month, well, everybody now comes into that $550, $600 range. So when you go to take COBRA, if you're older and that coverage on the individual market is $1,200 or $1,300 a month, but you could get COBRA for $6 or $7, it might feel expensive, but it might be a good solution. for our friends that are 25, 30 years old, for them to go pay $500, $600 a month, for them, it might be better to look at individual options in some cases as well. And then depending on what your income is, right? So if your income is below the limit set by the government, in a few slides here, we're going to talk about the marketplace. If we can get the federal government to help subsidize some of our premium, it might be attractive for us to maybe look a different way.
You mentioned something here, and I had a question come in early on this, so I want to address it.
Yeah.
You said COBRA usually lasts for about 18 months. Can you give us a situation where it may last longer than 18 months?
So that could be a whole nother seminar in and of itself, but high level, you can get COBRA typically, in some cases, from 18 months to 36 months. If there's a death, if there's a disability, and then if somebody continues to work beyond Medicare, there's options for family members to recoup some of that time as well. So depending on the specifics, we can definitely give advice on that. But 18 to 36 months, again, predominantly those that are disabled have the best opportunity at extending it. And some employers, frankly, are do allow beyond 18. But you'll find that 95 to 98% is going to be 18 months. And then when that 18th month comes, then we either have to look at what are we going to do now, or hopefully Medicare's in that range for some of our audience.
I think you're hitting on something important here. There is rarely in anything that we do, I think folks are familiar with this, a magic bullet, a silver bullet to a solution. COBRA could be part of a solution, and it needs to be part of a plan, right? We need to have a plan for bridging the gap, and COBRA is going to be a part of that, but it very well may not be the only part of that.
And when it comes to COBRA as well, before we move on to the next strategy, people need to be advised that it's not an all or nothing. So if you have a husband or a wife and a spouse, and let's say one person has pre-existing conditions and they need to have that coverage, we can take COBRA for one person. We don't necessarily have to take it for the other family members. So we look at every case kind of like a Rubik's Cube. The cool thing is we get to play with the stickers.
Yeah. That's great. So you mentioned the other strategies. So let's get into some of those. We've addressed COBRA, and you mentioned individual health insurance, short-term medical, or maybe even new group coverage as an option. Can you walk us through those? Give us the overview of those and maybe the pros and cons to going in those directions.
Yeah. So as we look at the short-term medical situation, well, let's talk about the marketplace real quick. So if you go back one to the marketplace scenario, so the marketplace was designed, it was actually, the law was passed March 23rd, 2010. It took until January 1st, 2014 to get it implemented. When it first rolled out, it had, some kinks like anything, and it's kind of settled in. But essentially, it was designed to not single people out for pre-existing medical conditions. So if you had a pre-existing medical condition, you were guaranteed issue. There's a lot of mandated benefits that are built in: maternity, child immunizations, preventative care, ambulatory care. There's a lot of things that have to be covered by the insurance company. For some people, those are great advantages. For other people, they're going, hey, I'm a male, I don't need maternity, or I don't have kids, why do I need child immunization? So it's one of those situations that it can help a lot, and then other people feel like they're paying more for benefits they may or may not need. So it's really an individualized approach. On the next slide here, it's going to walk through a couple of advantages and disadvantages. So again, the biggest advantage is pre-existing conditions. The more we know as advisors, the better. So we have intimate relationships with our clients, and they tell us, the fun part about what I do is I usually find out when people are getting married, when they're having kids, sometimes even before their spouse, because they want to know how these things are going to be covered. But pre-existing conditions are covered 100%. There's not even a medical question on these applications. Wellness benefits, especially for our audience, it's 55 and up. If they're looking at, colonoscopy is usually the big one. It could be $1,500 to $2,500. That might be something that we want the insurance company to pay for. And then there's no limits on coverage. When I got into the business 13 years ago, plans capped out at $500,000, $1 million. At the peak, it was like $2 million of coverage. If you have an organ transplant today, you're going to hit $1 million in a nanosecond. So being able to have unlimited coverage is a big deal and helps people sleep at night. The premiums are based on your age, your income, and tobacco usage. So it is what it is. Okay. However, there's potential subsidies based on your income. And maybe what we do for the audience as a follow-up is I have a really nice grid that says, if you're this many people in your house, if your income's under this, it kind of walks you through what tax credits may be available. And what you need to know about tax credits is it doesn't matter what your net worth is. We have clients that have a significant net worth, but now they're in retirement and their income or their modified adjusted gross income shows $47,000. Well, they might get $600, $700, $800, $900 a month tax credit. You're not doing anything wrong. It's 100% within the rules. It's 100% based on cash flow, not net worth. Obviously, when we start talking about Medicaid and access and things like this, net worth comes into play. Potential disadvantages. The networks are often local. So they're, it's kind of a nice way of saying smaller. Most of them are going to be HMOs, where you have to see a primary care physician, you have to stay within the network. They're going to manage your care. The only way the insurance companies can make a profit in a guaranteed issue environment is if they can control how you get your care. We saw in the beginning of 2014, Assurant Health, which still has some business, but they were one of the largest individual insurance companies in the nation. They went bankrupt in 12 months. Blue Cross Blue Shield of Arizona has lost millions of dollars. A lot of companies have lost a lot of money in the marketplace early on. Those that have been able to kind of survive it have been able to control costs and are actually, some of them are profitable. And the way the law is written, if they make too much money, they actually give refunds back to their customers, which is kind of interesting. Out-of-network services may be limited only to life-threatening illness. So if I have a Maricopa County plan or a plan in another state and I'm out of the coverage area, typically you're covered as in-network if it's a life-threatening emergency. As soon as you're stabilized, you want to get out of there because the bills are going to start to rack up.
For those of you out there, Matt mentioned that grid. I will get that from him and get it out to everybody. So we'll follow up with an email with that. That is the health markets, the marketplace. So can you talk to us a little bit about short-term medical? I know you were going that direction. We took a step back. Talk to us about short-term medical. What are the pros and cons? What should people be looking at there?
Yeah, short-term medical's been interesting. So short-term medical's been around for a long time. It gained popularity in like 2015, I would say. What happened is the insurance company got cute and they took one day off the plan. So instead of it covering 365 days, it was 364 days. They called it short-term medical. Those plans did not cover pre-existing conditions. There was no free wellness. There were no maternity benefits, no free immunizations. They were not compliant in the eyes of the government. So in the beginning, when we had penalties for not buying insurance, some people said, hey, I'm young, I'm healthy, I don't need those coverages. I want to save premium and buy a short-term medical. And when you looked at the cost of the short-term medical and the penalty, it was cheaper than paying full price. So it's gained popularity. So the previous administration didn't like it because it was taking healthier buyers out of the marketplace. So what they did is they passed a law and they said, you can only get a short-term medical for 90 days to really help people transitioning from one employer to the next. The current administration disagrees with the previous administration, so they've actually expanded the ability for you to get short-term medical. So in Arizona, and again, I'm licensed in 26, 27 states, so every state's a little bit different, but I believe most of our audience is here in Arizona. In Arizona, you can get short-term medical for 30 days up to 36 months. And frankly, 36 months in the individual insurance space is an eternity. But they are medically underwritten. You have to qualify to get them with your health. Obviously, they have some limitations and exclusions, but if you really understand how those work, for some of our friends that are 2 or 3 years away from Medicare, it could be 40 to 60% less expensive than COBRA.
That's great. And it sounds like it would be, once again, part of that plan, right? We may use short-term medical to just fill in a small area of need, a short period of time. We may use COBRA as part of that as well. We may use the marketplace. So all of these may work in conjunction. It's not just one or the other a lot of the time.
Yeah, Kobe, we did this actually just the other day. I had a husband and wife come into the office and he had some significant medical expenses. His pre-existing conditions weren't life-threatening, but his pharmacy spend was very significant. So with our counsel, we decided to put him on COBRA and we put the spouse on a short-term medical. and then they're both going to get to Medicare within that 18-month time frame. And then the whole dynamic's going to change on what we do from that point forward. So we just have to look at everything holistically and go, okay, based on the client's income, their age, their health, their desires, their lifestyle, what path makes the most sense for them?
It's all part of having a plan overall. It's important to make sure that you look at all your options, that you bring in the professionals, that you make sure that it all fits together and works in unity to get you where you're going to go. You have to have that goal. You want it all to work together. Very much like financial planning. This is a big part of that, what we do with our clients, and you're a great resource for that. So that's great. So we talked about the marketplace, and we've talked about short-term medical. I believe you also mentioned new group coverage.
You can kind of cruise through some space as well. I mean, it's crazy to see somebody is the audio there?
Yep, you're back.
Okay. So it's group insurance for me is exciting. Insurance, it's crazy. I'm just chipped differently. I get excited about insurance, and most people want to poke themselves in the eye with a fork. But when it comes to group, what I like the most about it is, like, I'm a problem solver. If there's a way for us to fix the solution, we're going to do that. So I'll give you a story here. A recent client of ours owned a very large HVAC, in English, air conditioning and heating business, sold it. He's 55, his wife's, in her mid 50s. And, they moved to Florida and bought a beautiful house and a boat, and they're ready to retire. But they got to go, okay, what are we going to do with our medical? Well, they wanted a very robust network of doctors and hospitals. And frankly, the marketplace didn't fit that. There's a couple pre-existing conditions, nothing significant. So the short-term medical didn't really fit that. And this gentleman in particular wanted to open a cigar shop. So his dream was to retire, open a cigar shop. So he put that together, and he actually employed his adult children, who are 26 and 28 years old. So we did a group of 3, him as an employee with the wife as a spouse, and then his 2 kids as employees. So we did a small group of 3. That now opened up 296 plans for us to choose from. Mm-hmm. So you do have to have people on payroll. There are guidelines, there's participation and things like this, but it really helps expand now our options of what we're able to do. And then obviously people in your team can give advice on what the tax benefits look like, if they're writing those off as the employer, the pre-tax benefit to the employee, and things like this.
So it is something that's going to be more specific to business owners, somebody that has folks on payroll. It's not going to be an option necessarily for somebody who's just retired.
It may not be, but if again, water finds its way. If there's a solution out there, my team is going to figure it out. I recently worked with a client, and I know that there were some questions that came across about some of the faith-based medical co-ops. And I think that's something that we need to talk about later on here as we get down the path. But this individual was on a faith-based co-op, and he was diagnosed with lung cancer. He intended to have surgery at Mayo Clinic, and frankly went to the co-op and said, hey, here's what I'm facing. And the co-op goes, we don't have that kind of, and because of insurance, regulated by the Department of Insurance. And I'm telling you the story that it's might be right for the right people, but you also have to be cognizant that it's not insurance. So the one that he was with was a smaller one, probably one that I wouldn't advise going with. And he came to me as a last resort, and his wife was literally crying in my office going, my husband's going to die because he can't get the care he needs. If we go to Mayo Clinic, it's going to cost $80,000. And frankly, we don't have that. So what we determined is he's a real estate agent. So I asked him, I said, do you have any employees or anybody that could be an employee? And he goes, well, yeah, when I go in for care, I'm going to have one of my other real estate agents handle all my business. Ended up doing them on payroll for more than 30 hours a week. And by doing that, it enabled us to put a group plan together. And within 30 days, he had cancer surgery and he's alive today. So to me, these are the things that, I wake up to do special things with my family, and I wake up to do special things for our clients. We don't have a silver bullet in every case, but we're going to try to figure out how this can work. So we've done groups of 2, and then I have companies that have hundreds of employees as well. But the group space is interesting for those that are business owners.
So we have, and this slide here, I think we've covered everything here, the advantages and disadvantages. So we'll go to our last option that you outlined at the beginning before we, to bridge that gap as we're discussing here, and that's Medicaid. So can you walk us through of Medicaid and when it would be available for folks?
Absolutely. And so Medicaid is really driven, in Arizona, it's called ACCESS, which is the acronym for Arizona Healthcare Cost Containment System. And we could give some resources to their website. And there's different people that are going to fit into the access scenario. But for the most part, depending on if you're pregnant or what your age is, or if you have disabilities, you know, the income thresholds are pretty low. I want to say the last number I saw, it's just under $17,000 a year. So if your income's under that, they actually look at monthly income. So it's like $1,412 a month or $1,415 a month. If your income is under that range, there's some very robust benefits for people. Some of your clients might be higher net worth individuals, but they have a 23-year-old child or an 18-year-old child. I know I have some friends and clients that, you know, frankly, have had kids that have gone down a dark path and got involved with, you know, the vices that exist in our world. And, you know, frankly, they were able to get access and get mental health treatment or rehab treatment. So we see it a lot in the younger generations, but some of our older clients, you know, Medicaid might be a solution as well, but they do look at your assets and things like this. So if you have a significant, even if your income drops below that 17,000, you know, if you have a 401k and equity in a home and things like this, you fall into a void where they say, yeah, your income may justify you getting benefits, but your assets say that you don't need to help. So that's where the marketplace, so you see the federal and state, right? So state, Medicaid, and then you have federal, which is the marketplace. If your income creeps up over, so we've had some clients who, you know, maybe they're everything's paid for and they can live off of $17,000 a year of income, but it might make sense for them to take out a total of 20 or 25,000 out of their 401k because that's taxable income. It bumps their income up a little bit. Now they go to the marketplace and they're getting $800-900 a month in tax credit. So, but to get the state Medicaid, you know, as it says there on the bottom, low-income individuals, pregnant women can qualify, children, some seniors, you know, and those with disabilities can typically have access to benefits.
I think the thing to stress, and I've stressed it twice already, but I'm going to stress it one more time here, now that we've kind of covered these options that are available to bridge the gap, is that there's planning involved. For folks out there, don't feel like it's a one-size-fits-all solution. Don't feel like you have to go through this alone. Talk to us. We can help you through it, get you in front of professionals like Matt to make a game plan. So I think it's important to know that these are all options that can fit together, not a one-size-fits-all. So Matt, correct me if I'm wrong. I think we covered the options to bridge the gap, which brings us to, as you like to say, you've said in many of our conversations in the past, preparing for the promised land of Medicare. And so are there any steps that folks out there should take as they get close to Medicare, to get prepared, to get themselves ready to go on to Medicare?
Yes, there are. And there's a lot of seminars out there, and I mean, there's great information online. Just be careful too, you know, of what you read and what you hear. I would stick to, you know, the bigger resources, Medicare.gov or CMS. You know, sometimes you have somebody on a blog and, you know, who knows if they're giving advice based on what's right for you or what's right for them. But getting to Medicare it's interesting. A lot of our clients that are 55 to 58, you know, they're kind of putting on the brakes going, I don't want to go there. I don't want to go there. And then once we start getting around the corner to like 63, it's like, it can't come quick enough. But so as we get into the Medicare discussion, the biggest thing is when do I apply for A and B and this kind of thing. And I think on the next queued up.
Can you see it? You're cutting out just a little bit. Can you see that one?
Yeah, let's go one more.
One more.
Yeah, perfect. So on the Medicare side of things, so typically Medicare is for those that are 65, or if you're under 65, you have certain disabilities, you may qualify for Medicare early. For the sake of this discussion, 65 is the magic number. So you're eligible to sign up for Part A and Part B 3 months prior to your birth month, the month of your birthday and 3 months after your 65th birthday. So 7-month enroll 3 months prior to your 65th birthday. Everything's going to start on the first of the month of your birth month. So if I'm born December 15th, everything starts December 1st. If I'm born on December 2nd, it starts on December 1st. The caveat is if your birthday falls on the first of the month, they actually let you start it the month early. So for those of us that have the first of the month birthday, you get a little 12-month or 30-day bonus. But there's 4 components to Medicare. So Part A is your hospitalization coverage. You get this allegedly for free. You've actually paid into it over your 40 working quarters. So you've prepaid for Part A. And then down below, you have Part B. This is your outpatient services. These are things like doctor visits, testing, durable medical equipment, anesthesia, pretty much anything that's not a hospitalization with the exception of prescriptions. And then Part B has a cost associated with it. So what Medicare does is they look at what your income was 2 years prior. So right now for 2020, they're looking at 2018 modified adjusted gross income. So this is where you really want to talk to your Beacon advisor or myself or all of us together, because prepping for Part B can be for some people an interesting thing. So if your income is under a certain limit, and again, we can get the income graph out to your viewers here. But for most people, it's going to be $144 a month for Part B. However, if your income starts to go up above the limit, they have what's called IRMA, which is an income-related adjustment. So your Part B premium can get all the way up to in the high 400s a month for our higher wage earners. So the top bracket is 150 and above, and there's really every flavor below that. So that's what's referred to as original Medicare. Where an agent would come in is, what do we do to help cover what original Medicare does not? And that's where really the discussion between, do I want a Medigap or a Medicare Supplement strategy, or do I look at a Medicare Advantage plan? They both kind of have advantages and disadvantages. And if you want to spend a couple minutes, I don't mind unpacking those a little bit and give a high level.
Please do. Please do.
So if I think on the next slide here, it might give us perfect 2 choices. So how a Medicare supplement works, actually go back a slide for me if you would, Kobe. It'll be a little bit easier on the A, B, C, D kind of scenario. So Part A, your hospitalization, it's about a $1,400 deductible for the first 90 days in the hospital. Then days 90 on are like $350 a day. And then once you get over, the next jump, it can be in the $700 a day cost. So Part A can get expensive. Obviously, you have to be, it's the first 60 days rather. So after you've been in the hospital for more than 60 days, the bill can grow. And I tell people, the worst year, you want to be cognizant of that. Part B has a $198 deductible and then 80/20 co-insurance. So you're paying the first $198, then the insurance company, or in this case, Medicare is paying 80% of the bill. You're responsible for 20. So those are the gaps that we look at in Medicare. So your Medicare supplement is going to help pay what A and B does not. I spent most of my career enrolling people in what we call Plan F, is in Frank. Some of your viewers may have it. They may have family members that have it. We've enrolled hundreds of people in that plan. Plan F covers all of A, all of B. You get zero bill. It was kind of the creme de creme. They're going to sunset that plan here in the next year or so. With that being said, the new kind of hot supplement these days is Plan G as in George. So if you're getting any free advice from us, Plan G is in George is something that you may want to consider if you're looking at a Medicare supplement. It covers all of A, and it covers the 20% of Part B. It does not cover the $198 deductible. However, when you look at the premium difference between F and G, it's more than $198 savings. So it's kind of a no-brainer to take that expense on and save the premium. Then if you go that strategy, then you'd have to look at a prescription drug card. Okay, the government doesn't force you to buy a prescription drug card, but they put some things in place that really highly recommend you take one. So you don't have to get it. However, one in the future, they assess up to your premium for every month you went without. So for some of our clients that aren't taking prescriptions, out of the 32 plans that are available in Maricopa County, we might just pick the lowest cost plan just so there's no penalty in the future. But with technology, what we do is we're not married to any one carrier. We put your prescriptions and your pharmacies into a slick program that we have, and it's going to say, hey, based on your prescriptions, based on your plan, or your this is going to be the lowest cost drug plan, and that's typically the one we enroll our clients in. So that's kind of high level on the Medicare Supplement strategy. The biggest advantage that this has is you can see any doctor in the country that takes original Medicare. So for those of us that want to travel and maybe have multiple homes, or we want access to care throughout the country, my opinion is the Medicare Supplement is going to be, very attractive. We are, here in 2020, July of 2020. And so right now for a 65-year-old to get, a Plan G supplement, it's about $115 a month. So if you have 144 in Part B, 115 for your supplement, and maybe somewhere between 15 to 20 for your prescription drug card, you got a pretty robust plan that can get you out there and protect your medical. I'll dive into the Medicare Advantage strategy and we'll kind of wrap things up maybe with some Q&A. But the Medicare Advantage strategy, what it does is it takes Part A and Part B, and you actually assign your benefits over from the government to an insurance company. So you'll see a lot of insurance companies spend millions of dollars on advertising. They're going to get flooded here soon on plans that might cost zero to enroll. So what happens is the government actually compensates the insurance company to manage your care. So if they can keep you healthy, they make a profit. So some of the plans are zero premium, some of them go up. There are HMOs, there are PPOs, but you're typically going to have copays at the doctor, copays at the hospital. A lot of plans maybe have a $3,500 to a $5,000 out-of-pocket max, but you're going to eliminate your supplement premium and your prescription premium. So for most of our clients that kind of live, work, play in their little village pocket, they see their 3 or 4 doctors, might be a fantastic strategy for them to look at. So you do have guaranteed issue rights for your Medicare supplement when you age in. So we typically recommend the supplement strategy for a lot of our friends that are turning 65, because you can always go to a Medicare Advantage plan. For the most part, there are a couple exceptions, at any open enrollment in the future. If you go Medicare Advantage and you want to go back to a supplement, in most cases, you have to qualify to do that with your health. And usually those that want to switch back have something going on in their medical, and it can be a bit of a challenge. But there's some nuances to all of that. So definitely talk to your advisor on what strategy might make the most sense.
I have to go back quickly because you reminded me of a story of the first time that I met you, which was a while ago now. And I remember you came in to meet with all of us and kind of talk about how you help in planning and the options that are available. And I remember you saying, I can tell clients in a meeting, I can compare the options, their prescriptions, I can find them best, and it takes very little time. And I remember it being pretty impressive what you were saying you could do. And we like to make sure that we're vetting people thoroughly in these conversations. So we said, really, you can do it that quickly? And you replied, yeah, I can do it right now in 2 minutes. And everybody kind of was aghast. And you pulled out your computer, and within 2 minutes, you had everything plugged in and a whole list of options. You mentioned that program that you have that is, I think you used the word nifty, and I have seen it, and it is quite nifty. So that's great. And we had some great questions come in about Medicare as well while you were speaking. Perfect. I know for the audience out there, that's important. I want to assure folks out there that we're already planning a second event where we're going to do a much deeper dive into Medicare specifically. So I know we've done some basics today, but we can't cover everything today. So if that is a topic that you'd like to know more about, maybe you have more questions and we don't cover everything today, stay tuned for what could be called part 2 of this event, and we will go much deeper into Medicare during that time. That's a great resource. We'll make sure that we leverage them well for the folks out there. So that being said, we have about, and let me pull this up here, we have about 15 minutes. So we're going to get through as many questions as we can. And as I mentioned at the beginning, if we don't get to your question, we will follow up with an answer. So still, please put your questions in the Q&A button at the bottom. If we don't get to your question live, we will follow up with an email with answers to those questions. So the first one I have here, and I think we'll start with this because it is right on topic, is what about Medicare supplements via AARP?
Yeah. So backstory on us. We have like 225 companies across the country that we represent. So we don't have everybody, but we have a pretty good footprint. That is a product that we do offer. I'm a big fan. I like it. You do have to be an AARP member to get that United Healthcare product. So you have to be an AARP member at the time of application. You don't have to keep the membership beyond that unless you're making changes on your plan. But AARP has a strategic relationship with United. They have great products. I mean, United Healthcare is the sixth largest company in the U.S. I've had clients that have had, hundreds of thousands of dollars of claims at Mayo Clinic and, paid $198 if they're on G. And if they had Plan F, they're not paying anything. But I think whether it's United Healthcare or Humana or Blue Cross or Mutual there's a lot of great companies out there. But what people need to understand is Plan G is Plan G. So it's the same coverage, whether you get it with one carrier or so the letter you get, the coverage is identical. What you don't get is the pricing can be different for different carriers. Obviously, customer experience, claims processing, and there's no really one magical carrier out there. So what our job is we're matchmakers for clients and companies. And if it works, we want to keep them there a long time. If we need to make adjustments, we make adjustments. But good product, been around a long time. They do well.
That's great. I'm going to do one thing here so that people can, now that we're doing question and answer. Matt, you can just see us now, correct?
Yes.
Perfect. So another question that we had come through actually early is Medicare when it comes to long-term care. Is there any coverage there?
Yeah, so you get 100 days of coverage for those kind of services. Outside of that, Medicare doesn't cover long-term care. So most people are going to want to look at that long-term care piece. And I know that your team is very well equipped to give that kind of counsel. Obviously, we can aid in that, whether they're looking at other products that exist, whether it be traditional long-term care or life insurance. As you and I know, there's a lot of different strategies for us to look at that. What I do know is 1 out of 2 people, once they hit 65, are going to need some sort of long-term care. The statistics are very interesting as far as who may need it. People might get hurt or sick and need, 2 out of the 6 activities of daily living. They might get better and not need it. They could ebb and flow, or, as we all know, Alzheimer's, dementia, some of these things can have a long-lasting impact. And frankly, putting that burden on family members is a very difficult thing to do. Some people have to do it financially, but it's definitely a sensitive subject. I know a lot of our audience may have either personally dealt with that with their parents or relatives. So a great question, but limited coverage when it comes to Medicare. You'll definitely want to look at that planning with your Beacon out the Medicare strategy.
Yeah, important to have a plan in place. It can get expensive. At end of life, those types of things, those types of illnesses can get very expensive. So important to have a plan in place. And if you'd like, anybody out there that'd like to have that discussion, please don't hesitate to reach out. That is what we're here for, and we can certainly do some planning around that. So I had a question actually jump in at the bottom of the list, but I think it's great because it's a kind of an example question. So the question reads, I'm currently 60 years old, covered under my workplace insurance, and I receive all my care at Mayo. Can I continue my care at Mayo when I transition to Medicare in 5 years? Obviously, we all know Mayo has excellent care. I've had procedures done there myself, so I know there is a desire to stay at Mayo if they can.
Mayo comes up a lot. It's in our backyard. We're blessed to have those great doctors. They do a fantastic job. So a couple things. If you leave your employer prior to Medicare, obviously COBRA is most likely going to be a valid option for those people because you're going to have that same network. If you're assuming you're going to stay working until 65, yes, absolutely. Your Medicare Supplement strategy is going to allow you to continue to go to Medicare or go to Mayo Clinic. There's not a single Medicare Advantage plan out there right now in the window we're in that has Mayo Clinic in network. So Medicare Advantage, out of network, Medicare Supplement in network. There's one carrier that we offer in the small group space that if you have less than 100 employees, that allows you to go to Mayo Clinic as well. So for those that fit in that business market, we can fit that.
Okay, great answer. Hope that answers your question out there. If anybody else has a scenario like that and they have questions, please send it to us and we will certainly get an answer back to you. Continuing on Medicare, a lot of questions on Medicare here. If I am eligible for Medicare, is there any advantage to go with Cobra?
No.
Perfect.
No.
So moving along then, we have about 6 or 7 more minutes, so we'll get through as many as we can. Another kind of example question, we plan to travel internationally in retirement for several months. What options do you recommend for coverage while overseas?
Great question. So if you have a Medicare supplement, you do have some international coverage. It's usually a $250 deductible, 80/20 coverage with about $50,000 of benefit. So you have some coverage. It's not a whole lot. We partner with some global travel companies as well. So if you're going to Europe for 30 days, to me, I kind of look at where am I going? What does it cost to get medical care there as a cash pay? But short-term 30, 60-day travel policies are not very expensive. We have access to a lot of carriers. If you wanted to, you have your dream trip coming up and you're going to go travel some different locations. If you want additional coverage, there's plans out there. And again, that doesn't matter what age you are. So if you're, under 65 and you plan to do that, and you want travel policies, my office can handle that, no problem. But yeah, you do have some international coverage on the Medicare Supplement strategy.
So another question here. When do I have to sign up for Medicare Part A and Part B if I plan to work past age 70?
Good question. So if you're over the age of 65 and you're still employed with your employer, a lot of times you're enrolled in Part A without even knowing it when you turn 65 because it's a free benefit. So it really kind of comes into play if your employer has more than 20 employees or less than 20 employees on who becomes primary, the employer or Medicare. It really doesn't affect the Medicare beneficiary very much. But if you're still working beyond 65 and you have qualified group insurance, you do not have to enroll in Part B as in boy. Upon your exit from the company, that's a qualifying event, then your Part B would kick in, and then you can get either a Medicare Advantage plan or a supplement to help cover what that does not. So if your group coverage, and most of them are qualified, you do not have to enroll in Part B and pay that additional premium. You can just stay on your group plan. But I would advise, if you are over the age of 65, is talk to an advisor, because if you're paying, even if the company's paying 100% of your benefits, but you have a $3,000 or $4,000 deductible, it might be less expensive for you to take on some premium and reduce your deductible. Every case is different, but we've seen a lot of people that turn 65, look at Medicare even though they're working for an employer.
That makes sense. And I just had a question come in, and so I'm going to ask it. And I think this is a good one to answer, because people have this question when they're hearing from an expert. How do you get paid?
So I take my 10-year-old and my 9-year-old, and we get a stand in the front yard, and we sell lemonade on Saturday. No, it's a valid question. So we actually get compensated by the insurance company. So my advice to everybody on this call is 100% free. We ultimately get compensated when somebody picks a plan. So what's different about us and a lot of our competitors is I've been doing this for a long time, as I mentioned at the beginning. So I'm not motivated to push product to pay my bills. I'm really motivated to put people in the right position. I get a small check every time somebody makes their monthly payment. So I want to make sure they understand it, they like it, they keep it. And if they don't, they communicate that back to us and we make adjustments. So we do get compensated by the carriers. We don't charge consultation fees. That's 100%. I think it's in most cases, it's going to be a great scenario for the consumer. However, there are agents that are new in the business, maybe don't have the experience, and they're pushing products based on compensation. It happens in any insurance space, whether you sell home, auto, life insurance, or what have you. But typically your seasoned agent has a renewal account, and we want to build I'm a 3rd generation native, as I mentioned. My parents did business on a handshake in their honor. That's kind of faded, but we still want to give that kind of good old country business, just do the right thing for people, and the compensation piece will happen. And if it doesn't, then we throw the kids on the curb and sell lemonade.
Sell lemonade. That's great. I think we have time for one more question. And
Perfect.
It's a specific scenario, but I think it can be applied broadly. So I'll have you answer it both specifically and broadly. The question is, I turned 65 on January 17th of 2021. What year is the income based on to determine Medicare cost?
2 years prior, so 19.
So income for 2019, 2 years prior being kind of the
So they look at the year you're going in, they're going to look 2 years back. And this brings up, I think, a good final point. So a lot of our clients that are turning 65, some of them might be higher paid executives, or they own a business and they're selling their business, and there might be a couple of years of disbursements. So your income might be higher for a year or 2 years, or frankly, your income might be higher during your working years, but once you go to retirement, it's going to drop down. There are interesting ways where you can get your IRMA or your income related adjustment for Part B reversed if you can justify that, hey, I sold my company and I got 2 big checks, and then 67 and beyond, my income's going to go down. The government typically isn't very motivated to say, hey, let's lower your Part B premium. You have to be a little more proactive and fill out some paperwork and apply to try to have that reduced. Yeah.
Matt, this has been great. For those of you who put questions in and we did not have a chance to answer them, as I mentioned before, we will follow up and get you an answer. So please stay tuned for that. As I said, that's all the time we have for today. But let me close by saying this. And I know that those of you who have joined these events before have heard me say this before, and it remains as true as it ever has. We understand that these are uncomfortable times. They're difficult times. And it's during times like these that our clients rely on us more than ever to provide regular, up-to-date, and what we hope is valuable information. So as I've said several times, you will receive a follow-up email. And as part of that, please submit any feedback or questions that you have into that email. You can just respond to that email, and we'll make sure, A, the feedback is taken to heart, and B, that your questions get answered. If you're not currently a client of Beacon Pointe, but you feel that you would benefit from a discussion with one of our advisors, whether this is regarding your insurance needs, your retirement plan, your investments, maybe your income plan, please, again, simply let us know by responding to that email, and we'd be more than happy to set aside a chunk of time to speak with you. So Matt, thank you for taking the time today. For folks out there that want to contact you directly, where can they reach you?
So there's a couple ways you can find us. If you go to our website, it's healthmarkets.com and then /Matthew Gardner. Frankly, the best way is to call our office, 480-524-1015. And we'll give the contact information out via email. We'd love to hear from you and feedback on the presentation, things that we could do better, things that you really enjoyed so we can share with other people. And Kobe, I appreciate the opportunity to work with your team and provide some hopefully refreshing information.
Well, thank you, Matt. We will include Matt's contact information in that email that I mentioned, so you can reach out to him directly. From all of us here at Beacon Pointe, I want to thank you for joining today. Please stay healthy and stay safe out there, and we look forward to seeing you again soon at a future event.